La situazione economica di crisi che affligge l'Italia non affligge solo il nostro paese, ma come ben sappiamo anche altri paesi europei. Qui al Congresso dei farmacisti europei c'è stata la testimonianza di una dottoressa, di una collega, di una farmacista ospedaliera che lavora in un paese del Portogallo, di una cittadina che si chiama Vila Nova de Gaia, e che ha raccontato la sua esperienza e i suoi problemi per condividerli con noi, per aiutarci a capire appunto cosa succede anche nel resto d'Europa. Questa dottoressa si chiama Aida Batista, appunto l'abbiamo incontrata e farci raccontare un po' cosa sta succedendo in Portogallo. Aida, which is the access to drugs in your country?
Nowadays, we have several problems to access drugs, not only in hospital pharmacies, but also in community pharmacies. As the price of the medicines lowers so much, pharmaceutical industry is not the market in Portugal is not as appealing as it was before, and our government also put in place some measures to avoid the expense and lots of expense in our country. So to get, for instance, the innovation and new medicines besides the market authorization, we also have to wait for an evaluation of the medicine in economical terms. Before that evaluation, we cannot buy the medicines for the hospital. For instance, I can tell you, and I give you an example for hepatitis C, the two drugs approved 4 years ago, it took 2 years to be approved in Portugal, one of the drugs, not the two of them. On the other hand, the lowest and those drugs who are very, very cheap as the generics, they start to disappear from our market. We have lots of shortages, and we have to buy from the board for another country the medicines. It's quite strange because we could buy them with a price equivalent to 50 cents or something, and now we are buying €5 a piece or something like that.
People have access to life-saving drugs, or it's a problem also in that difficult situations?
No. Luckily, we don't have problems with life-saving drugs because the governments don't like to be their names on the papers. If we have that kind of problems, the first news on the papers will solve the problems for sure.
You have explained also the problems in terms of human resources for what concern hospital pharmacists. Which is the problem exactly?
Okay, as you can imagine, a bailout country has to cut in expenses, and one of the expenses, the first expenses they cut was on salaries and increase of taxes. That's how they can get money to buy the drugs and to have the healthcare system working. So the cuts were so high, they cut the salaries, they increased taxes, they increased the time of working, the week time of working without payment, they cut an extra job. Everyone is demotivated, the sick leaves are immense, and whenever someone resigns or retires, we are not allowed to contract anyone to replace those people. So we have more work. People who is not working gladly, and sometimes I think that we are jeopardizing our health system.
There is something positive in this difficult situation?
Yes, we are positive, we are optimists, and hospital pharmacists are exemplar professionals. They are excellent professionals, and they are ready to all the challenges and to all the changes. So I think we will survive for this bailout program.